Hey everyone, my name is Jamie and my group's topic was Alzheimer's disease. My PICO question was, could adherence to the MIND diet delay the onset of Alzheimer's in adults without the disease? Alzheimer's disease is a condition that affects a person's brain and cognitive function, and it's characterized by memory loss as well as reduced thinking and reasoning capacity. And as it progresses into its later stages, it affects a person's ability to perform activities of daily living, such as eating and speaking. My target population is adults without Alzheimer's in the US. And some acronyms I'll be using are the MIND diet. And the MIND diet is a hybrid of two diets already. So the Mediterranean and the dietary approaches to stop hypertension, DASH diet. And the Mediterranean diet is a diet that emphasizes moderate fish consumption, as well as the consumption of plants, fruits, vegetables, whole grains, beans, legumes, and moderate red wine consumption. While the DASH diet emphasizes low sodium intake, decreased consumption of red meat, and whole grains and fruits and vegetables. So the two diets do have some overlap. And when you put them together, it becomes the Mediterranean DASH intervention for neurodegenerative delay. Alzheimer's in the US, 1 in 9 adults 65 and older has Alzheimer's in the US in 2021. Alzheimer's is the 5th leading cause of death in Americans 65 and older. And in 2021, the prevalence of Alzheimer's has been 5.3% of Americans between 65 and 74, 13.8% of those between 75 and 84, and 34.6% of Americans 85 and older. So as you can see, there's an increase in prevalence as people get older, which is why age is one of the most notable risk factors for the condition, in addition to genetics and family history of Alzheimer's. And this is an issue of growing clinical significance due to improvements in medical technology. People are living longer than they used to in the past. Unfortunately, there's no cure for Alzheimer's, so healthcare providers are more focused on prevention and treatment. Presentation and synthesis of research. So an inverse correlation was found between greater adherence to the MIND diet and likelihood of getting Alzheimer's. Basically, participants who adhered the most to the MIND diet were found less likely to have the disease. 2 studies found an improvement in memory in participants who had adhered to the MIND diet, and multiple studies found that participants who adhered to the diet the most showed the most improvement in cognition when a test that was performed called the mini mental state exam was performed on them. And this just highlights the cognitive benefits of following the MIND diet and the benefits it has against Alzheimer's and delaying the onset of Alzheimer's. Conclusions from research. The MIND diet is beneficial to cognition. Most of the studies found this. In one way or another, it affects the brain in a positive way. A qualitative study was performed on participants in Northern Irish and Italy, trying to find out why people might be hesitant to adapt this diet to their lifestyle and what motivations they might have to introduce it to their lifestyle. And the Northern Irish said that time, work environment, taste preference, and inconvenience were potential barriers, while for the Italians, potential barriers were culture and lack of family support. So for the Northern Irish, motivations were improved health and memory, as well as good quality food. And Italians were motivated by improving their cooking skills and improving their knowledge and capabilities, as well as the health component of this diet. Recommendations for healthcare providers would be to talk to the patient and address any possible barriers, any reasons they might be hesitant to start using this diet, and inform them about the cognitive benefits, because this could be a good motivator for them. Encourage them, invite the patient's families to participate, since this was one of the barriers for the Italian people. So also provide cooking resources, because the Northern Irish people said that it might be inconvenient or time consuming to adapt to a new diet. And also taste preference was another barrier. So just show them that this diet can be adapted to their culture. Nursing implications. Most of the research found that even little adherence to the MIND diet can be neuroprotective against Alzheimer's and delay the onset of the disease. And it can be protective against general cognitive decline in people who adhere to it. Though the more a person adheres to it, the more cognitive benefits they will experience. Some future research recommendations would be to have studies that have bigger sample sizes, since the bigger the sample size, the more conclusions we can draw about the effect of the diet against Alzheimer's. In addition, having sample sizes that are more generalizable to all populations, that would be beneficial to research, since some of the studies had very specific samples of people. So having more generalizable samples would be great in our ability to draw conclusions from the data. And that is it. Thank you very much.